Good evening. Let's call this meeting to order for the Champaign County Board Committee of the Whole for Finance, Policy, Personnel and Appointments, Justice and Social Services. It's Tuesday, December 12th, 12/17, 6:31. Roll call, please.
King. Marsh.
Here.
McGuire. Michaels. Mitchell. Patterson.
Here.
Petrie.
Present.
Rector. Rosales.
Here.
Storr. Summers. Tinsley.
Present.
Anderson. Clemens. Coert. Cruz. Esri. Furtado. Goss.
Here.
Harper.
Here.
Hartke.
Here.
And Weibel.
We have a quorum. Seek approval of the agenda. Any addenda?
So moved.
Moved by Mr. Rosales,
Second.
second by Mr. Hartke. I want to pull items 9E for number 4 and number 5 because, as I reported to you in an email earlier, I just screwed up and those don't belong there. So remove items 9E, 4 and 5. Any other changes? Okay, see none, all in favor? All opposed? Motion carries. Seek approval of the minutes, November 14th, 2017. They're in a separate copy on your desk. They were emailed to you earlier today. Moved by Mr. Esri, second by Mr. King. Discussion. See none, all in favor? All opposed? Motion carries. Public participation. We only have a couple tonight. You get up to 5 minutes each. First up is Kathy Emanuel. Turn the microphone on first, that button there, and you can just leave it on.
Okay, all right, thanks. I'm Kathy Emanuel. I just came to make a couple comments on the item on your agenda for the dissolution of the Nursing Home Advisory Board. And I've been a member of the advisory board for a number of years. And so just a few comments, really. I think there is value to the advisory board. I'm not going to go through the litany of why I think there is and what has been accomplished, not only while I was there, but all my predecessors. But, you know, the reason for which it was originally established, which was to provide some additional expertise and oversight to the nursing home, because an additional liaison between the nursing home and the board, just because it's such a critical element of the efforts and the resources of the county. Still continues to be a valid reason for keeping the advisory board. And it does bring together people who have both interest and expertise to just really focus some time, since you all have so many other agenda items. So there is somebody there on the board who has long-term care experience. There's somebody who's worked at their nursing home for years and now is there on a volunteer basis, on a regular basis. I have way too many years of healthcare experience and a couple years working specifically for a nursing home consultant and an organization. There are 2 members who have had nursing home people in the nursing home, so you really do get some expertise that you would not necessarily get. There's some financial expertise, and we're really focused on just the nursing home. So we've done some things in terms of the strategic plan. I don't want to get into it. This is not for me here to promote the advisory board, except that I think there are some things that have been accomplished in terms of the strategic plan, paying attention, requesting the RFP. And then the second point is really what would be the benefit if the original reason for establishing it continues to exist, what would be the benefit of dissolving it? And I know at one meeting I attended, Patsy mentioned that, you know, if nothing else, there are some additional funds that would be available with the dissolution of the advisory board. And I've been on the advisory board long enough to know that nobody is there for the compensation that comes with being part of the advisory board. So our liaisons, I'm sure, will be coming on this tonight, but last night at our advisory board meeting, the advisory board voted to forego the compensation that goes with the advisory board and have those funds be used for the nursing home instead, and making that recommendation to you all. So the issue of it being an additional cost would go away. And then I really think if anything, my recommendation would be that going forward, we do a better job of communicating and being given some assignments by the county board so that the Nursing Home Advisory Board can make sure that we are meeting the requirements or the needs or suggestions of the county board. That's it. Thanks.
Thank you. David Laker.
I don't have much to say tonight. I think that thing's on.
Yes.
I just wanted to take a few minutes of your time and thank you for it ahead of time, because I would just like to encourage this group to get together and somehow resolve this, whichever way we go. There's just a lot of people that are kind of on tenterhooks about what's going to happen at the nursing home. And I realize that you can't produce a buyer out of the air. And that part of it is kind of adds to the problem. And the other part of the problem is what it's going to be sold for, because if we don't get enough out of it, we're maybe in worse shape than we are now. But anyway, I just like to encourage this group to really get together and fix this problem. We need to make it go away. You guys need to concentrate on other things that are pressing business. And Sue and the people over there would really, really appreciate you resolving this problem. I know there's 22 of you here. And I don't know how many opinions that encompasses. I don't know what, because I would guess that under different or given circumstances, well, you might have one or as many as 3 or 4 opinions about what it should be done with the nursing home in a given time frame. But anyway, if you could get together and make this thing go, I'd appreciate it. And I know there's a lot of people in this county who would appreciate it too. Thank you very much.
Thank you. Claudia Lenoff.
Good evening. My name is Claudia Lenhoff, and I'm the Executive Director of the Champaign County Healthcare Consumers. And I was just here at your November 14th meeting when I was part of the presentation on the Justice and Mental Health Collaboration Program, JMHCP. I served as the facilitator for the JMHCP's governing body, so I was here in that capacity representing that group. On November 28th, Ms. Patsy Petrie wrote me a message thanking me for comments that she said I made on the public record. However, Ms. Petrie misrepresented my comments and blind copied a number of people on that message. Because I don't know who received Ms. Petrie's message, and with her encouragement, I felt that I needed to be here tonight to speak to this publicly. Ms. Petrie wrote to me to thank me for, quote, putting on the public record during the last Committee of the Whole meeting that our community not only needs a community behavioral health center, but also such is needed in the jail along with expanded medical facilities. In fact, I did not state that our community needs, quote, a community behavioral health center. We already have a community behavioral health center. It's called Rosecrans, and multiple services that can be accessed in the community. And I sent y'all an email with a handout that explains what services are available. And although our community could benefit from greater availability of community-based services, I have never advocated on behalf of Champaign County Healthcare Consumers or the JMHCP for a community behavioral health center. This distinction is important, advocating for services versus a center or another building. It's an important distinction because resources are scarce and we need to plan and develop and support services and resources in our community based on evidence for the need. I am aware that Ms. Petrie very much wants and advocates for an assessment center or a community behavioral health center. However, I do not appreciate my words being distorted and various different parties being blind copied with the message sent to me, making it look like I said this during public comments. This is also difficult because if people who don't know what's going on with mental health get this message, they might get the impression that there aren't services out in the community. And I think, in fact, what we need to do is help people to understand what is available. A lot of times people don't know because when you don't need those services, you might not pay attention to what is there and how to get there when you need to. It's in the moments when people really need those services that they start looking around. And so I want us to help people understand what's available. I have a handout. I emailed it to y'all. I'll distribute it here. But it's important for our community to know that we do have resources. We have a crisis line available 24 hours a day, operated by Rosecrance. That phone number is 359-4141. We have a crisis team. We have a respite center, also now called a residential crisis stabilization unit, where people can actually go and stay and stabilize from having a crisis. And Rosecrance also has an access department. They offer walk-in hours where people can walk in during those business hours and get started on, their path to getting the services that they need. The final report from our Justice and Mental Health Collaboration Program speaks for itself. It's very rich. It's very dense. There's a lot of data. There's a lot of identifying of gaps and needs and resources available, and it can be read on the Sheriff's website under Public Documents section. Also, I'm available by email or phone or in person to help answer any questions that may be needed. But I do want to say that I don't appreciate being emailed with comments that I did not make and then blind copied. I'm now having to do my diligence, I feel, as the Executive Director of Champaign County Healthcare Consumers and the facilitator for JMHCP, and going and speaking to different groups and communicating with them. I don't want people to be misinformed. I don't want people to think that we do not have a behavioral health center in our community. We do. It's called Rosecrance, and it offers a lot of services, and what we need to do is help people understand what those services are and how to access them. Lastly, I also do not want to see y'all dissolve the Nursing Home Advisory Board. It's part of transparency in this community and accountability, and a way for consumers and community members to hear and to share their concerns with a board specific to the nursing home. Thank you.
Is there any other public participation? See none, we'll close that and move on to communications from the county board members. Do we have any communications? Mr. Harper.
Well, I see a new face, but an old face back in the crowd, but welcome back, Deb. Chair looks the same, so glad you're here.
Thank you, Mr. Harper, I agree. Anybody else? Okay. Let's move on to Justice and Social Services, Mr. King.
All right, thank you, Mr. Chair. Just like to note, I guess, a couple of things here. We have the reentry program quarterly report for September through November in the packet here, pages 1 through 17. And then monthly reports are all, I guess, submitted for Animal Control, Emergency Management Agency, Head Start, Probation and Court Services, Public Defender's Office, or Public Defender, and then Veterans Assistance Commission are all submitted online there. So all reports are available in each department's webpage through the department report page. And there is no other business. However, I did want to offer a few comments in the chair's report, if that's okay, Chair. All right. So I was not here at the last COW when the Racial Justice Task Force came and spoke, and so I know I've been out in the community and speaking with different folks, and I just wanted to offer some feedback on that report. So I recognize the circumstances and climate which the Racial Justice Task Force grew out of, and some of the issues that were discussed at that time, even within the board here, as I wasn't a member of the board at that time. the challenges of stating and framing the racial disparities in our community, creating a committee of the community to review the data and the lived experiences of folks in our community, and then finally sharing the findings of that report to the shock and surprise of some, and then to the uneasy confirmation of others, is hard work. And I think speaking to some of the board members, speaking to some elected and unelected community leaders, it feels as if people are ready to begin the work of trying to address some of the disparities that were discussed. And so I just wanted to make sure to take the lead and explain or share that, you know, I have begun to speak with different folks in the community, and I encourage our community to continue to come to our board meetings, visit Urbana's City Council, visit Champaign City Council, the U of I Council board meetings, the school boards, and wherever there is space to engage around the issues of racial justice in our community. And because I think engagement is really the first step. And so with that, thank you.
Thank you, Mr. King. Next up is Finance, Ms. Michaels.
As the treasurer has a monthly report, that report is on file and you can look at it at their webpage. Cash flow projection report presentation, please, Mr. Farney.
Mr. Welch sends his greetings, but he's not one for long goodbyes. So he asked if I would present this. So bear with me. All right, let's start with the nursing home's cash flow. The balance today is $264,493.86. The payrolls average is now at $238,000 a payroll. That has gone up just slightly since your last committee of the whole meeting. The last two payrolls have been between $250,000 and $265,000. I understand that you may actually see some increased payroll this month due to a contract and semi-annual performance bonus payments. So that'll be something that'll need to be accounted for throughout the month of December. I think, as Dan has pointed out in the past, the area that we really need to look at is revenue. And the revenue for the month of November was down by $280,000 compared to the average for the year. That's this number down here. As you can see, for the month of December, the home has already collected $583,000, more than they collected the entire month of November. So I do know a large insurance payment came in, and that was very much needed. So hopefully we'll be able to see December be closer to the average for the year as far as revenues go. Ending cash balance projection, if everything stays the way it is right now, we're looking at ending cash balance at the end of the year of negative $27,000. If we look at the general fund today is at that top number. These are all three of the funds that go into that bank account. $4,826,751. What we need to look here at is at the Fund 080 only number. That's what we're projecting for the end of the year, $4.1 million for the fund balance. Now, that number, if we had not made various loans and transfers to the nursing home, would be much higher. And that's what we need to look at next here, which is here. The two items in yellow have been added since your last committee of the whole meeting. That's the last $100,000 in distribution from the subsidy or loans to the nursing home that were authorized earlier in the summer. And then on Friday, debt service is due, and we are projecting that the home won't make that, so general corporate fund will be covering that. So your total for 2017 in loans and transfers from the general corporate fund to the nursing home will be $1.271 million. And again, remember that $1.271 million, that's what our general fund could be higher if this hadn't happened. So the general fund is definitely a concern. Do we want to look at projections for next year first? Or
If I can ask a quick question here, and then Ms. Petrie, you can ask a question. Looking at the first page about the payables with the payroll and stuff, we have some items on our agenda tonight that may make a difference to that payroll adjustment. Also an item that was promised year-end due to some of these things being put off. Is that in that total or not, or is that an additional $80,000?
that would be additional funds. We use just averages for the year.
Okay.
It's no problem. I tend to always have to ask this question for clarification. I'm not that good at accounting, but on the first page, when you when you had that up here and you were showing
The nursing home cash flow page.
Right.
Okay.
And the revenue, is the nursing home still using an accrual method of accounting?
These numbers are cash.
These are actual
These
cash.
are actual numbers that have come into the treasurer's office.
Okay, all right, that's what I needed to understand. Thank you very much.
Sure.
Anybody else? Mr. Morris?
The 1.2, when I look at the statement of cash flows, there's another $1 million in increased accounts payable, and then there's a fund that we pay by statute. So it's a total of around $3 million to the negative. Is that correct? Another $1 million in increased accounts payable in January through October.
That's right.
Okay, thank you.
I would ask the question, of the 1.2, is that mostly prior to SAK or is?
Yeah,
What
SAK came on board in July, right? So looking at this, we've got, that July loan of 185, that was already in progress by the time they took on. So if we look at this, these would be your numbers since SAK took over. Now, SAK has been doing a lot of catch-up from the previous management. So I would not read anything into that, but that's what's happened since they took over.
Okay, thank you.
Let's look at the projections for 2018. These are just, based on where things stand today, and then maybe. There we go. All right, so first off, here's the general fund, and that's transferring over from the end of the month to the first of the year. And as you can see, we have areas of concern, especially in March and April of next year, when we start getting down into the 1.2 million and below. That is less than the total amount of payroll for the general fund during those months. That's when we would be looking at loans from the Public Safety Sales Tax Fund, as has been done sometimes in the past, where that just basically helps us keep a healthy balance in the general fund should an emergency happen. We have not done loans the last 2 years. The calendar has just worked out that payrolls allowed us to not need that. And then real estate money, as you can see, starts coming in May, and then it builds up to a healthy balance throughout the year. Nursing home cash flow continues on the trajectory that it has shown for the last 12 months. And as you can see, by the end of 2018, that deficit just continues to grow throughout the year. So the need for subsidies, loans, whatever you want to call them, from the general fund, right now just using averages, unless things change, mostly through census, unless things change, the nursing home continues on the same path that it has shown for the last year.
Anybody else have any questions for Mr. Farney? Mr. Goss and then Mr. Anderson?
Thank you. Am I right that it takes about $100,000 a day to operate the general fund? That seem about right?
Seems about right.
Thanks.
So the numbers we're looking at here don't include paying any of the debt that the nursing home has.
That's correct.
So
This is just using the averages of average expenditures, which have been to just try to keep up with current vendors, not really paying down. Now, we have paid down some of those ones that we have settlements with, but it's, just staying within the averages.
Mr. Marsh?
I'm concerned about the increased accounts payable. Just with it going up $1 million this year, and of course we have agreements with some. If it continues to rise, at some point, are we going to have more pressure from other vendors, especially in light of our objective to pay employees first? We're going to have to increase our accounts payable on an ongoing basis. Is there a breaking point with other vendors? What do you see there?
I really can't answer as to what the breaking point is, but I would have to assume so.
Okay. Thank you.
It's right now the home is, again, this is actual money, so it's not accrual method. This is actual cash money. The home is losing about $130,000 a month.
Mr. King?
Two questions. The first one, could you speak to maybe what now is sort of slowing it? Are there things that are slowing down payments to the nursing home that you could sort of speak to what they might be?
And perhaps our management team from SAK, who's here tonight, when they do theirs, they can probably tell me or tell all of us better details.
Okay.
But I do know, for example, the Molina Healthcare, one of the larger insurers that we use, their payments were delayed due to a billing issue that we all hope has been settled, and we understand there's been movement on it. So hopefully we'll get back up to the averages at the very least.
Got it. And then my second question is your monthly revenues. Is that, how'd you come to that number? Is that based off historical?
It's based off historic data.
Okay. And not last year, but the last few months?
It's
data?
the last 12 months.
Last 12. Okay.
Mr. McGuire?
Okay, I'm going to do a little history. We've had the example when the other treasurer was here. He's been gone so long, of course. But he discussed the history of the nursing home and how there used to be a capital budget and some funds on hand, a reserve for the nursing home going back 15 years or whatever it was. And it took some time because there was erosion to revenue over that 10-year period or whatever it was. But I want to get to the general fund now, and what you just spoke about, that seems to be an erosion in the average fund balance now going into March and April. And if we continue to see what we're seeing now, which is that our fund balances aren't growing, or they're not staying the same, what you expect to see, this year, next year, and how long do we have a capacity to continue having a decent reserve for the general fund balance, for the county reserve and budget, and are we turning into what the nursing home used to look like and what it's turned into now as far as their reserves?
I think that what we're going to be looking at during January, February, March, and April is looking at the loan that we can do from public safety sales tax. That's what's going to be our fallback. I wouldn't say that we're heading down the same path that the nursing home has. I wouldn't say that. The general fund has other means to correct itself. Unfortunately, that's through severe cuts, layoffs, things like that. But unfortunately, that's what would have to be addressed at those times. But I don't think I can predict that right now.
I would hope not, and I'm sure that's what they said when the nursing homes reserve started disappearing. But what kind of decisions they make to get to this point?
The general fund is the key to county government. So this board, our administration team, myself, the new auditor, will be monitoring it every step of the way to make sure we don't get to that point.
Anybody else have any questions? Yes, Mr. King?
So this question / comment, I apologize, but I think you mentioned SAK took over in June, but it was June, or I thought
July,
it was
I think. Was it July 1st? Mm-hmm.
Okay, so July 1st. And then did you say that we're losing about $100,000?
About 133,000.
Related to the nursing home?
Mm-hmm.
Okay.
Yeah, that's the average for the year.
Okay, for the year?
Yeah, each month.
Okay. I think I saw a number somewhere.
Yeah, it was on the very top there. You did.
Okay.
Yes.
Okay.
Yep.
Thank you.
Okay, no more questions. Moving right along. Thank you, Mr. Farney. There's a resolution for authorization of facsimile signatures for the Champaign County Treasurer's accounts and the Champaign County Collector's accounts. Have moved by Mr. Rector, second by Mr. Brooks. Any discussion? All in favor, say aye. Aye. Any opposed? No. Motion pass. Okay, that's consent. Okay, number 4, resolution for authorization of signatures for the Champaign County Treasurer's accounts, Champaign County Collector's accounts, and investment instruments or investment accounts. A motion by Mr. Harper, second by Mr. King. Any discussion? All in favor, say aye. Aye. Any opposed? No. Okay. Next up, put your auditor hat on. We have a monthly report from the auditor.
So I'd ask that you just accept and place the monthly report on file, and then we'll go into the nursing home AP report.
We will put that on file then. And then next up is the nursing home.
So I am passing around right now an updated version. The nursing home business office was kind enough to get me up-to-date numbers this afternoon. And so in my original memo that you may have seen, it mentioned that there were some that had not been entered into the system yet. They got most of those entered into the system. So this is the most current and up-to-date numbers for you. As of this afternoon, the grand total obligations for the home is $5,124,287 to its vendors and lenders, including the county, and that's up $451,000 from the previous month. And as I reported just a few moments ago, for comparison's sake, the general corporate funds balance today is $4.1 million. The home owes $2,422,853 to Champaign County, and those numbers are broken out for you, and it shows any increases. Most of the increases are in Social Security and IMRF, as should be expected as we continue to have payrolls. Not included on this is the debt service that hits on Friday, so that will add $260,000 to this total. As I reported earlier, wearing the other hat, all of the loans have been exhausted as of November the 17th. We have made progress with some of our vendors as far as the large vendors go, but unfortunately that means there's been a trade-off, and so other vendors don't quite hit the $100,000 mark yet. But for example, Health Pro Rehab is now down to $347,000. That was up close to $500,000 at one point. So those numbers are broken out for you as well. Food service vendor is around $70,000. various utilities, we're up to about $70,000 with them. The delay in revenue has hurt the ability for the home to pay the must-pay vendors. We've had to prioritize things, and sometimes even the vendors that need to be prioritized have had been pushed back by a week or so. As I told you earlier, the home has $264,000 in cash on hand today. We are going to pay some bills on Friday. The payroll next week, due in the treasurer's office on Wednesday, if it keeps up with averages, will be around $250,000 to $260,000. It could be higher depending on various bonuses and retro pay. Is that okay? Deb's shaking her head, so okay. So we're still concerned about that last payroll of the month, but we'll work with the home to make sure that we keep the lights on, we keep food service going, and we try to keep as many vendors happy as possible. But it's very much every day is a tense situation with the home as far as handling the AP.
I have a question, if I may. Looking at the receivables, which is what pays the payables, there are some receivables that have been on there for a long time that just went through an audit. Do you foresee charging off some receivables that have been there for over 2 years?
Yes.
And when that occurs, maybe I should wait till the nursing home comes up and ask them what we're going to do to that, because that will certainly put them in a flux of an upside down.
Well, on paper, it does. On paper, it definitely does. But it doesn't affect the actual cash coming in and going out. And so we had a long discussion with the nursing home representatives and made headway on that today. The outside auditors also have made their recommendations, which we're in total agreement with. And so we are going to work with the nursing home folks with SAK so we can come up with a realistic number instead of just saying we're just going to randomly say 210 days, we're cutting everything off. That doesn't make sense. They're working on a report for us. SAK is working on a report for us so that we can go through and be realistic in the number that we need to write off. And there does need to be a write-off, and it needs to be done this year because it's been far too long since that's happened.
Anybody else have any questions, Mr. Marsh, and then Ms. Petrie?
To your comment that we have 264,000 now, and we have a payroll that could be close to that, is there a reason why we should not push vendors out farther and have a buffer for employees first? In any corporation that I've ever had any contact with that was in a dissolution type of situation, as from a financial standpoint we are, the employees were where we put the buffer. And I would suggest that we not only push vendors out further at this point, but we created a buffer so we didn't have these emergencies and possible emergency board meetings.
That would be something that we can suggest to SAK. There is the high probability of additional funds coming in still this month. We have not received the fourth quarter IGT payment, so that is something that's not reflected in any of these reports because the state is so unreliable, we don't know when that's going to show up. That literally just shows up. They don't give us advance notice or anything. Those have been running at least $100,000, sometimes as much as $120,000. That could be where that buffer could be built in if it shows up. It very well may, I hope it's there tomorrow morning, but I'm not holding my breath for it. So that is something we could look at to prevent the need to do that to make payroll. Now, there are certain vendors, though, we have to get paid. And so it's one of these where you have to weigh the pros and cons of both of them.
Again, in a business that's in a dissolution type of situation, I think it's very important, regardless who those vendors are, that we develop a buffer to pay those employees first and talk to the SAK about that. Because, in fact, if it comes in great, then we can look at paying the vendors, but I think the buffer for the employees should be first. And so, again, we don't have a crisis situation saying how we're going to pay our employees, which would be catastrophic for our county in terms of management. And I just would, in a friendly way, suggest that.
Thank you.
Thanks, sir.
Mm-hmm.
I concur that we need to protect the paying of our employees. So I appreciate Mr. Marsh bringing that up. What I'm trying to work on is what you've put up there in projections against the projections of the general fund. And is there some way to do a visual so we can see or have some sense of the, I'm looking at your numbers, the words I'm going to use is the point of diminishing returns, and how long the county can continue to buffer things and not put the county in a situation where our rating goes down, things that we have to protect as due diligence for the county and what we have to do with the county. When I looked at your numbers there, they're a little bit disturbing.
They're very disturbing in my opinion.
Well, it's trying to be gentle here. But I'd like to, if it's possible, to give us something that we really can wrap our heads around better where this is going, because one of the questions I had, if we were looking at a window of time of 6 months to see what might happen, or a window of time a year or 2 years or 3 years. Now, 12 years, I realize that's a lot of assumptions to get out that far. What does that do to the county statutorily and by code, what the county needs to be doing? And are there things that we can ride through or not over this time? And I don't think we've had quite that picture presented to us, if it's possible to do so. Thank you.
Thank you. And I agree also that we need to protect the jobs in the nursing home as best that we can. I don't know that we have the funding to be able to keep pushing it toward the nursing home. And we talk about a buffer. As I look at the report, it talks about $2.4 million that is owed just to vendors, and to push them back further. This report says that that's an increase of $150,000 more that we owe vendors from the month before. And if I remember right, it was like $123,000 more that was owed to the vendors from that month. So another buffer, which means holding off maybe another 30 days to pay vendors, is another greater increase of money that we're not paying vendors. All that impacts the care of those at the nursing home, and means that more people aren't being paid. The residents aren't being taken care of the way they should be. More money is diverted from the general fund of the county board and the services that we're supposed to provide here. So none of that sounds very good. Thank you.
Anybody else? Mr. King? Oh, Ms. Furtado, thank you.
I just want to, I have a point of clarification. You had mentioned that some of the accounts receivable is going to be written off. Can you just explain a little bit more what you mean by that? Is that just going to be debt that is then going to just be permanently in the ledger of the nursing home? Or when you say written off, is that a hit that is going to be taken to the general fund?
No, what we're really saying on that is that the home is not going to collect those funds, and so it's going to come off of their statements.
So just to clarify, that's not going to be reflected in the general fund at this time?
That's not going to hit the general fund,
Okay,
no.
thank you.
Mr. Farnick, so my question, I may have been a few years back, but there was maybe a letter, I couldn't tell if it came from the county administrator or if it came from your office, where there was a letter, I guess, written to the state, some state contact person, about maybe the placement of payment when we receive pay. Does that happen every year automatically? Or?
No, we are in an accelerated payment cycle with the state. We're prioritized already, and that's a permanent thing.
Okay.
Yeah.
Thank you.
Now, Occasionally, the state has contacted us and said, hey, we can move you up a little bit. This is what we need from you, and we've worked with them, but that hasn't happened, boy, 18 months probably. But when they do come calling, we jump and help them however we can.
So is it always the state initiated, or can we initiate a, hey, here's how this?
It never hurts to contact legislators, the comptroller's office. You know, anytime I have a chance to, you know, we're in communication with the comptroller's office quite a bit just because of the work we do. And so we always put in a, you know, good word for Champaign County Nursing Home if you can see any way to get us accelerated even further. But county nursing homes are prioritized.
Okay, thank you.
Anybody else? Thank you, Mr. Farney. Next up is the nursing home. We have a financial statement summary and a financial report. Whenever you're ready, ladies.
Okay. Good evening. Well, we do have some good news. Looking at October census numbers, we have beat the budget on the overall. We're 5 residents up in total numbers from September to October. So September total census was 132.17, and October is 136.90. We've also taken the liberty to extend it, even though you don't have the updated financial packets for November and December. We've gone year to date, and in November, we were up also to 137, 1 patient more, or 2 patients, and that residents. And then December, we've hit our budget, but we've actually gone over, we've already gone over our budget because our Med A residents, we were budgeted for 5, and as of October, the average census was 13.6. So that's approximately 8 residents up at approximately $400 or $500 per patient day on the revenue side. So it's a big change from September's numbers. And in looking in all of the areas, including managed care, as we go up, and we'll report in latter months, November and December, have all gone up too. To the point in December where we budgeted for even managed care, it was 3, and we're up to 8, including with an increase in Medicare A as well. So from a trajectory from October, November, and December, even though you don't have November and December yet, not final, it continues to go up. And we've gone beyond what was budgeted. So from that perspective, the revenue continues to go up. Our net revenue increased, now we're going to go back to October, from September to October, by $140,000 due to the increased Medicare census. And our operating expenses are slightly increased due to the increased revenue and the increased residents that we've brought on. But again, from an economies of scale perspective, you need 1 administrator, 1 DON, 1 MDS coordinator. All these things are 1-1. The only increase is in the direct care staff. And so that's why, from an economies of scale, your revenue can go up fairly high and your expenses don't have to go up as high. Non-operating income is also up, and net income loss has gone down from $122,954 in September to just $66,574. That's a huge improvement. And so your net loss is declining, and that's based on more revenue, as well as the IGT will be increased by $4.30 a day. Now, these are all, I know we're listening to all this news, but you have to see incrementally, it is getting better. And nursing services expenses, again, slightly up due to the increase. Your gas costs are $9,000 greater than prior months because gas is more expensive than electricity, as you well know in your homes too. And the equipment and repairs have gone down because, as many of you may have known, the doors and the security system and everything was broken when we came in, and it took a few months to get it straightened out. So we hope at this point that's straightened out. So as you'll see, as the numbers come in the remaining months, you're going to see that there is a trend. And the trend is that the numbers are getting better. And the census is getting better. We are now getting census from all the hospitals on a continual basis. There's active marketing programs. We had an enchanted forest. Many of you have read about that in the paper. We had local businesses come in and donate trees. They came in and they also decorated their own trees. And this has been a hit in many of our other facilities that we operate. And it really was very positive. We continue to right-size the staff within the confines of the union contract. We're working closely with the union, and we have open communications with them. And, again, our CMI, we're working on improving the CMI. The rules have changed in the nursing home industry, believe it or not, starting in November, and at the end of November 28th.
November 28th.
It's crazy, but that's federally, all the rules change. You have to have a infection control person, someone, I think is on staff, as well as a, what was the other position?
You have to have someone that's
risk manager.
actively working and looking at your risk management and trying to do quality assurance and performance improvement. That's a requirement that you have to be very involved with. And our risk manager, we're looking at all of those areas, not just from a clinical standpoint, all those areas that might affect cost or that could improve revenues. We're looking at those. And one of those areas now that we're working on currently now.
Could you talk into the microphone, please?
I'm sorry. One of those areas that we're currently working on right now is our workers' comp. It's an area that, for whatever reason in the past, there was not close monitoring of that. And so as we look at why our staffing numbers are higher than what we expected, if we have a person that's injured themselves in some way, they've been on light duty, but yet they can't take a full assignment. So we're working with our work comp carrier now to try to get some real guidelines and oversight of work comp injuries. And we believe that is a way that is going to help decrease the staffing hours and hopefully decrease our premiums.
Yeah, and the work that they have to do, even though if they're on light duty, has got to be useful. Can't be just sitting and filling in boxes or something like that. And these are the types of things that there was no real control in the past. So we've kind of taken over on all of those expenses. We've found little things here and there that we've been able to improve on, to the point where someone had authorized prior to us weekly eligibility runs on one of the systems, which was entirely unnecessary. And so that was causing a cost that we just found out about that. So we've stopped that occurring. We've, every time we turn around, we find something. We even found CPR in services by the American Red Cross that were being given, and if people didn't show up, if the employees didn't show up at the facility, they still charged the facility for these types of in-services, and even though they weren't really announced prior. So we've stopped all that, and we're looking to go to the local fire department, all the places where these types of in-service can be given for free
And
to
I
the
think
county
another
facility.
one that was real important that we just discovered is that, when you have residents that are discharged to home, typically you want to follow up to see how their stay was. Did they have any concerns? Was it a good stay? Was their care good? And we discovered this had been contracted out to an agency to do those follow-ups, but not a lot of that information was being processed.
That
and it
was put on a
expensive.
graph.
That was expensive. And we've deleted that, and we're doing that ourselves through our social service department.
And we have a program called the Perception of Care that we already have implemented and brought to the facility, which is a follow-up of people that were discharged to see, what their feelings were. And we actively monitor that on a monthly basis.
That's wonderful, ladies. If we could get to the agenda item, which is financial statement, a summary, and the detailed financial report. I believe there's some people that have questions. Mr. McGuire, did you have a question about things that they'd talked about before we get into the financials?
Yeah, going back to the census numbers, I believe at one time our census was at 139, so I'm a little interesting that you say I think you're trying to do a lot of good, positive things, but now we're talking about 132 for 2 months and then 137, and then you went on to talk about some estimates, I believe, a 139 or something like that, but for December. Do you have accurate numbers for November and December that don't include Carl Hold beds? I mean, actual people paying? Is there exact numbers?
Yes, our November average daily census is 137.57, and so far December to date is at 140.
That's year to date.
Not
it's
hold
December.
beds.
It's December. December month to date is at 140. I want to take you almost 6 months back, when in July your census started dropping to almost 127 number. And at that time, early August, we did our forecast and projection for the rest of 2017 to see what we think realistically we can expect in census development. We did that. And we expected to August to be at 130. And we thought it would be great if we hit 130 mark because we were starting at 127. We ended the month at 131.58 average, which is over budget. September, we were trying to get to 130, 132 still. We're at 132.17. We closed October at 136.9. Was 13 Medicare when our budget was 5 and 136. November, we're at 137.57 versus 136 budget. And 140 for December is what we budget for, but our Medicare is 4 over budgeted. And same applies to managed care. So our mix is stronger and reimbursement will be higher. All right?
So then you're up five in your census.
Overall,
but the
on
cost,
target was budgeted,
can I finish my
but
comment?
Medicare is higher.
Okay, but I'm talking about the costs. Now you went on the cost. You're up 5 in your census, which is about 4%, maybe 5% in census, but you're up almost 9% in operating costs in 1 month. I don't understand that part. There's a pretty significant difference. You would think that the fact that there's an additional few people that were increased census, they'd be able to take those costs over more people. If this continued through a growth to 200 in census, the cost would be astronomical in operation if those operational costs increase for each 5 in census and growth.
Your losses September to October decreased by 57,000. Yes, you did have some nursing expenses that are higher than prior months because the acuity of the patients required higher therapy, requires some pharmacy and drug labor. We did staff for that. I can tell you we also had in a G&A expense, we had some legal expense there that was not initiated by the nursing home, but we had to acknowledge invoice from law firm that was engaged into working RFP and OTA. So there are some expenses that we can't avoid that are initiated in this building, and there are some that we can control. Our goal is to control direct cost of providing care that is in our power. I can tell you that we heard that our payroll in November was higher. It's not a surprise to you, nor a surprise to us. We had immediate resignations from some nurses after they heard of potential sale of the facility. What impact it had on nursing home and the staffers there, they had to immediately start recruiting people. They faced overtime from the staff that was willing to pick up extra shifts. We had to pay them. Then all the new employees that we were able to recruit, as a nature of business, we have to orient them prior to letting them work the floor. That expense was significant. It was out of our control.
That will be in November.
Are you saying that you haven't had to orientate any other employees before now? Because we've been doing this for a while.
These are new employees.
I know they're new employees. The turnover rate at the nursing home has been high for some time, for 4 or 5 years I've been here. And they haven't seen these cost increases before. And the agency nurse use was a lot higher than it is now. So I'm a little confused at the costs that you're talking about.
It was probably more slotted versus immediate resignation of 6 or 7 nurses that we had to replace. That is significant number for the nursing home. It's not 1 or 2 that is orientation for 3 days. It's 6 at the same time. That's where the burden is.
Do you have any other questions? Or one thing I'm going to go ahead and ask as finance chair here is if you would have a paper report that you could email to us. Normally, even though we get it the same night as your presentation, we at least have something that we can look at to compare numbers and things. So if you could send us or email the paper report.
Was emailed to the county on November 28th. The package was
delivered. You're talking about the September package, right?
No, October package.
October, okay.
Package is what is on the agenda for discussion today. And October package was emailed by Tom Denker to the county on November 28th.
Okay, I'm sorry. And I guess maybe the confusion comes is that if we're going to present on the October and then you're talking about November and December, it's hard for us to kind of catch back up.
We said that because we wanted to show you, we talked about the census. You know, we want to show you that it's an upward projection, that we're continuing.
And that's good. The other thing that I'd like to make a comment about is that even though there are losses, and at one point you had said that they are less, you have been lent $250,000 in the last 4 months by the county. So that needs to be added to the amount that actually would have been lost to the county. Anybody else have any questions? Mr. Marsh and then Ms. Petrie.
We didn't finish our financial discussion, if you don't mind.
No, go
I want to
ahead.
take this as an opportunity to cover some issues that I heard that you were concerned when JJ was presenting cash flow statement, because I want to remind you, the financial package that we present for the nursing home is accrual basis. When you mentioned the loan of $250,000, that's a cash basis piece. So that's why you're not seeing it on financial statements, additional losses. That wouldn't be an accurate way of reporting it. What I also want to state that when we did our initial assessment, after we got engaged, it was already August, we projected that late October to early November, we will need to use the last funds available. It was no surprise to us because I knew of this need in August when I first started looking at your financials, and I projected the cash needs. I was very well aware of how much in expenses we'll need and what our incoming cash model is going to look like. You had a concern about how we can maybe accelerate payments from the state. County, as JJ mentioned, is already part of accelerated program with the state. Why they're not reaching out to you and asking you if you need any help is because as of December of last year, state of Illinois changed the entire approach how they pay for care. They don't pay you with a voucher that you have no control over. And if they're behind with payment, then you call controller's office and say, can you please expedite my payment? This whole approach had changed over a year ago when we as nursing home or management company actually bill state of Illinois for every patient that is Medicaid participant for the care. And the sooner you bill, the sooner you get paid. That's how the program works nowadays. That's been in place for over a year. So we bill on the first, and basically the way state works, first come, first serve. So we bill, and that's why we are expecting the payment next week, either later this week, around the 17th to the 20th. So my expectation is that the payment will arrive next week. So that's as fast as you can get. Discussion. No, I just want to make sure. Then there was a concern about how we're going to meet payroll needs. I can tell you that I go over AP approval process prior to we county cost checks to vendors. And I can assure you that I'm not going to approve any payment to the vendor unless it's crucial to care of the patients till I have enough in reserve to meet next week's payroll. Because I was expecting IDT quarterly payment late November or by now. It didn't happen. Though I know the program is in place where feds fund the program within 45 days after the quarter is over. That didn't happen. I'm not going to let my employees that care for this 140, though to some of you it's a low census, but these employees that care for 140 patients not get paid timely for what they already earned. To me, it's a business, and employees will come first. I will work. Right, and I will work with vendors. Right.
Two questions. Good to see you folks tonight, and Ms. Michaels. I think a thing that would probably help us all, the accrual accounting is about impossible for us to dig backwards through, especially in a setting like this. What would be good if we got a simple one-page statement of cash flows every month?
It's part of the
You could
package.
simply see how much was paid. I mean, it'd be a very easy thing to do.
It's part of the package, I think.
Excuse me?
Cash flow statement is part of the package. That's
Well,
being sent
as a
every
monthly
month.
simple statement of cash flow, I don't see that, but.
We can look into that and provide it
Yeah,
to you.
because it would be with a few number of expensive categories and income pieces, a statement of cash flows it'd be a lot easier to have that discussion too. Even though we know we hadn't received certain things that are accrued, it would be easier to track if you could provide that for us. I don't know if, I think that would answer your question too. When you asked about the loans and that kind of thing, you'd see the inflow from a loan that we gave on a statement of cash flows. And on a month-by-month basis, we could easily see the progress too from.
I will check the package that was provided. I know that the regional package that I provide to Tom Denker had that page on a monthly basis.
Right.
Maybe he removed it prior to sending it to the county, but I know it's part of my package that I was preparing for him.
It seemed like it'd be very easy to do and be very, very helpful. The second comment, I just want to restate with you here, since you're making decisions on payment, that when we talk about a buffer for the employees, we don't mean a buffer that says if we receive this money, we're going to be able to make the payment. And what I mean is a buffer that covers the next payroll. So we put the vendors and other payments in a position that our employees truly are first, that there's not just maybe a payment that makes it, then we'll get to pay them, that we actually we already pushed the vendors out some more than a year. Well, then let's push them out another month and make sure that our employees, that there's a full payroll buffer in there. And so we don't have to have not just the challenge of an emergency meeting, because we can certainly do that, but there's really not a need to, and it's not putting our employees first not to do that. So I would highly suggest that we structure our vendor payments such that we have created that $250,000 buffer. So we know 2 weeks out that we're next week, that we're 2 weeks out that we can pay the payroll coming up. Because we know what the payroll is going to be. You folks know more than anybody, but thank you very much.
Thank you. first, congratulations that you're beating your own projections. That's always nice. Last night and again tonight, you talked about beating your projections, but could you give me or send to me if you don't have it, in hand, exactly the numbers in Medicaid, managed care, Medicare, VA, and private?
Budget for 2017?
What the census is now? Yeah, that would be great.
I think it's part of the package
Yeah,
as well.
we did submit that in the package, so I'm not sure why you don't have the package that we submitted.
Oh, I haven't.
I believe some of it actually is very difficult to read. If you look at our packet, it really is a little bit difficult. Not that it's your fault, it's just that a lot of it is kind of blurred up a little
Tell
bit.
us differently what to do, because we have submitted all these numbers. I mean, if you want us to bring them this evening too, we can do that separately.
Yeah, it just gets a little difficult to read sometimes on our copy of the copy of the copy, something of that nature. But I think also that might be a little bit confusing is that we do have the September numbers in here, and you keep referring to October, November, and December, and that's where we're all trying to catch up with everything.
No,
and
so we've submitted a
being off
packet of
little bit.
October numbers, so
Okay.
I'm
Well,
not sure. We can certainly bring our packets with. We.
Anybody else have a question?
Well, I think that's the issue. It's October, we're in a meeting in the middle of, the end of this, we're starting in December, and you're quoting numbers that are in December, and we don't have anything to really look at for December.
We're just quoting census numbers to you. We have a full closed October package.
Right, and we understand that the census is the most important number that's here, how many people are actually in the nursing home. So when we don't have any document to look at or any numbers to really look at, we're just hearing it, and we don't see a.
Mr. King, you were next.
So my question was, I think that thanks for the numbers, and thanks for any of the work that you're doing. I think I do understand the report. It's just because I've probably spent a little bit more time with it than I want to admit. But I wanted to ask a question about the local hospital hold beds, because if census is at 140 for December, I think that's great. Could you also speak to maybe how many hold beds there do exist? Or?
Yeah, I think we have 2 bed hold.
Okay.
Yeah, so because some of those are paying and some are not paying.
Got it. So it basically it's not necessarily a significant portion of what you're factoring in.
Right.
Okay. Thank you.
Just one thing to publicly acknowledge, these ladies spent about an hour and 10 minutes with me today that they didn't need to do, so I asked.
And it was enjoyable.
The reason I've not asked a question tonight is because I asked 100 this morning, so, but it is, and I can attest to this, it is extremely difficult for us to understand the difference between cash basis, which is what we get from our treasurer and our auditor, and accrual basis, because as they explained to me today, we could be looking for some of this money might not come for 45, 90, 120, 180 days. It just all kind of depends. It flows in, so we're likely not to see this for some of this money for a while. So I do appreciate you guys spending an hour and 10 minutes this morning with me and taking rapid fire questions.
Yeah, and it was really helpful. I think understanding, because we really got into some detail. And I think it was very helpful for the understanding. A lot of the questions that Mr. Goss had in the previous meeting, I think were entirely answered. We went into really extreme detail. So we were pleased. We all walked out feeling good about it.
Great. Mr. King?
Okay, so I did have 2 more questions. The first, so you mentioned a little bit about the staff. Could you speak to maybe staff morale and how you all view things within the day-to-day? Maybe you gave that last night in that presentation, but I don't know if you could speak to that today, and I have one follow-up for that.
Yeah, so, I think that the vacation or the holiday is over. The new people are here, and we're no longer new. And I think that we're making a lot of people accountable. And some people like it and some people don't. But I think with the two kind of part-time contractor positions that we've had to add on because of the new regulations, the risk manager and the infection control. Yeah, they are very, very involved daily at the home and helping. And if we feel that for one day that according to our census needs that we may be a little over, we immediately, there's a policy in place to call everyone to the desk and we ask who would like to go home. And it's really quite easy, We don't tell people, you have to go home, you have to go home. There's always people that want to go shop, that want to go take care of their kids or something, and we volunteer, and it's positive, and they do it. And we're able to meet our budgeted numbers, and we don't wait a month later and look back. We're doing it every single day as the needs are appropriate. Mm-hmm.
Then my follow-up question was about the market. So with all of the different nursing homes in the area, when you look at the context of what you all are doing with the census, is that similar to what other homes are doing in the area, or how would you rate that in comparison if you're following the market?
Yeah, so I think that there's a little bit of renewed interest in the fact that there's been some good changes. I think word has gotten out. We are constantly trying to connect with the hospital. We made some terrific connections. We went in and did presentations, PowerPoint presentations. We met with all the staff and we renewed friendships and interest. I think it went very well. So I think that we may be getting a good fair share. I'm looking at our numbers on a weekly basis, and it's a huge difference than what it was when we were in July. I mean, I'm seeing 10, 12, 13 admissions in a week, and we're seeing discharges. But we're seeing the good thing is these are good discharges because these discharges are going home after therapy and after being at the facility, getting good care and going home. And then if they, God forbid, ever have to come back, they'll come back. So I think the reputation out there is definitely changing. They know that there's new people there, and our therapy department, we kind of walked in and didn't have such a great, there was problems when we walked in. We've built a terrific now relationship with them where they're Yeah, Kathy Emanuel has been very helpful in working with us, putting together quality initiatives with some of the physicians and some of the key people at both hospitals. We are going to be presenting to them again, to some of the top-level physicians at Presence and Carl, next January 8th or 9th, during the same time that we have this meeting earlier that day. And we're going to give them our quality indicators. We're going to talk about possibly a telemedicine program that they may fund. We're going to ask them to fund that, to work with us. We're also talking about respiratory.
And that's a hope.
It's a hope. It's not for sure, but they asked us to come back and bring them numbers and let them know what we'd be interested in. So we're going to come with actual numbers of what our quality indicators show, our medical and our clinical outcomes. And I think that they'll be pleased to see that we're working closely, in meeting all those goals. So I think from that perspective, on a marketing perspective, we've turned a corner.
Thank you for the numbers. A couple of clarification questions, if I might. I did learn last night as I listened to you all that basically managed care pays the same as Medicaid. Did I?
Medicare. The reimbursement
As
rate on
Medicare
commercial
or
insurance
Medicaid?
is Medicare, closes Medicare. You have managed Medicaid, and they pay you at Medicaid rate. It depends. If you're Medicaid eligible, and have Medicaid provider number, but you have it through the insurance company, they will reimburse, based on your income situation, they will reimburse you at Medicaid rate. If you have traditional HMO plan, your reimbursement rates will be close to Medicare.
It's an alternative to the Medicare
Okay.
program.
So when I look here that you have aid and managed care, do I assume that the payment you get for those per day is the same as Medicare?
Close. It's over 400 a day.
Yeah, so
So that's close.
To Medicare.
Okay, so I can add that number to the 11 Medicare there,
Yes.
so that gives me 19, right?
Yes, that's accurate.
Okay, and then Medicaid is 74 according to your numbers here, and then you have Medicaid pay pending at 22 and private pay at 22. Is that just kind of the counter? Can I assume those are the same individuals?
No.
No?
44 total, 22 private and 22 that are waiting for Medicaid approval.
It just happens that the numbers are the same.
Okay, but where is the pool? Where does the pool come from for the Medicaid pending out of this total census?
I'm not clear on your
where's
question.
the Medicaid?
Were they Medicare?
Where do they show up?
Under private. On the income
They were
statement, it's going to be
private.
part of private, because at this point, Medicaid is not going to pay us till they
Okay.
approve it.
All right, fine. So my rule of thumb has always been back of the envelope to get things balanced at the nursing home is that one overpayment of Medicare covers two underpayments of Medicaid as a rough. So we have a long way to go to balance this out then based on the census that I see here.
I can tell you that care for Medicare patient will cost you more because they have typically higher acuity and they have shorter stay at the nursing home.
Right, I understand
So
that.
the cost of caring for this type of patient won't be the same as for Medicaid patient that is long-term resident. Different needs. I would probably say 2 to 1.
I mean, rough,
Yes,
just
2
back
to-
of the
2 to
envelope.
1. You can
Not-
do 2 to 1.
Etched in stone.
2 to 1.
So we have a bit of balance,
Yes.
payer mix.
Yes.
Okay, thanks.
Mr. Anderson?
Just regarding private pay, using the number of 22, how many of those are Medicaid pending?
If you look at the census page that I just distributed, you have 22 private pay patients and 22 patients that are in-house that are Medicaid pending, that we are waiting for the state to approve. It just happened it's the same number this month, but if you look at October, let's say, you had 14 pendings and you had 22 private pay.
Did you just give that?
Anybody else have questions for the ladies? Okay, thank you very much for coming. I know we ask a ton of questions, but we
No, that's okay. And
Try not to bounce around too much on
no,
you.
We want to try to
Yep.
make sure that we're answering what
Right.
your need is.
appreciate you coming. Next up, budget amendment transfers. Have budget transfer 17-00008, Fund Department 080 General Corp. to 041 State's Attorney in the amount of $3,250 to pay for a temporary contractor via Express Personnel. Motion by Mr. King,
Second.
second by Mr. Rosales. Any discussion? All in favor? Aye. Any opposed? Okay. Next up, budget transfer 17-00009, Fund Department 092 Law Library to 074 Law Library in the amount of $5,290 to cover the increase in book costs and help the desk navigator salary. Have a motion from Mr. Tinley and second from Ms. Furtado. Any discussion? All in favor, say aye. Any opposed? That passes. Budget Amendment 17-00046, Fund Department 670, County Clerk Automation Fund to 022 County Clerk with an increased appropriations of $1,000 with no revenue increase to cover expenses in the above line item, which is expenses on the county clerk. I believe if you go to the page. Yep. I have a motion by Mr. Esri and second by Ms. Coert. Anybody have any questions? The clerk is here. Okay, all in favor say aye. Any opposed? Nay. Okay, that passes. Budget Amendment 17-00047 with a Fund Department 080 General Corp to 036 Public Defender with increased appropriations of $1,600 for current budget cannot support the payout of $11,823.53 for the long-term employees. Motion by Mr. King. Second by Mr. Esri. All in discussion? Mr. Goss.
Just a point. So it says down here, our current budget cannot support the payout of 11,000, but we're only asking for 1,600. Can you clarify? Can anybody clarify that?
Ms. Busey.
We don't budget for retiring or employees who leave for their payouts, and we ask the departments typically to absorb as much of that as they can throughout the year. So they're just telling you they've absorbed a majority of this payout, but do need the 1,600 to cover to get through the end of the fiscal year.
Okay, thank you. That's what I assumed, but I wanted to make sure. Thank you.
And if I can add to that, I believe number 5 will be the same issue. Okay, I have a motion. Any more discussion? All in favor, say aye. Aye. Any opposed? Okay, next up, Budget Amendment 17-00048 from Fund Department 080 General Corp to 031 the Circuit Court with increased appropriations of $20,270 for additional expenditure required by bargaining unit agreement to pay retiring employee for accrued benefit time. Motion by Mr. King, second by Mr. Harper. Any discussion? All in favor, please say aye. Aye. Any opposed? Okay, motion carries. Number 6, Budget Amendment 17-00049 from Fund Department 080 General Corp to 042 Coroner with increased appropriations of $22,996 for increased toxology, autopsy, and histology expenses incurred in fiscal year 2017. So moved by Mr. Harper. I have a second by Mr. King. Any discussion? We have the coroner here. Do you have any comments, Dwayne?
Briefly just real quick, did you see if there's I think the page before this was a handout, or before my budget amendment was a handout just explaining the costs and what we budgeted. Typically for the toxicology expenses, we've budgeted low. We actually adjusted that for next year up to $45,000. We were at $34,600 this year, and unfortunately I've had a large increase in toxicology expenses. One, we've had increased cases that needed toxicology, and the other was we've had a lot more cases come up where I've had to do toxicology that I've never had to do before. So there's a lot of fentanyl analogs that have come out in the last year or so, different. Every time they outlaw a version of fentanyl, some chemist makes a new version by changing one little part of the chemical makeup. So we've got acrylfentanyl, butylfentanyl, mono something. I can't even pronounce half of them because they're coming out so quickly. So the labs, those aren't included in our original test. So when I do an autopsy, I run the test, the lab notifies me something showed up in the test that's not in my original test I ordered. And of course they can, most of the time they can run the test for it, but it's going to be an additional cost. And we've seen a lot of those cases this year that we haven't seen in the past. So that's on the toxicology. The other thing to note is histology. When I budget for autopsies, I don't take into account histology usually because some cases don't need it, some do. It depends on what we find during the autopsy. So it usually washes out in the end. If I budget for 145 autopsies and I only do 140, the budget for the other 5 autopsies a lot of times will cover what I spent on histology. Unfortunately, this year I saw an increase in histology testing, and that's where we take tissue samples and make them into microscope slides and look at the cells under a microscope. The other thing that happens is because we provide autopsy services for several of the other counties around us, when they order histology on a case that they did at our facility, I get the bill for that because we just have one account at the local lab, and then I bill them for that money. The problem is any revenue that comes into my office, that's considered revenue. I deposit that in the general fund even though I paid for it out of my original budget. So about $3,500 of the histology was money I've already been paid from other counties, but it was deposited in the general fund this year. So it kind of shorted me some in my autopsy budget. So that's just a brief summary there, the sheet. Does anybody have any questions?
Mr. Esri.
Yes, thank you. Dwayne, I just had a question. Rough idea, doing it in-house as opposed to out of county on like a per case basis, roughly how much are we saving doing it in-house?
Oh, we're saving a lot, actually.
Just asking, because I know
sure.
when we brought it in-house, that was kind of controversial. I mean, yes, we're spending money, but we are ultimately saving money.
My undocumented savings, I guess if you want to call it, that I don't spend on my own autopsies is significant. I would be looking at $200 to $300 fee to the facility that we would be sending the bodies to do the autopsy, plus staff time to take them there, be there, and come back. Right now, we're in our office all the time. The gas mileage, the wear and tear on the vehicles, we're saving probably per autopsy just on our cases. I'm going to guess around probably $500 per case, you know, and I could get you better numbers than that, but it's definitely, it's a savings for us, plus every county that comes into us, I charge a fee to. So the fee that I charge them more than covers our expenses for providing a facility for them. So it's the best deal we could have going as far as our own autopsies too, yes.
Well, I don't personally need better. I was just wanting, because I know when we did bring it in-house initially, it was a little bit controversial, kind of with some members or stuff, if we were going to save money, but we are definitely saving money.
And there were upfront expenses. There were upfront expenses. Our autopsy sink that was installed cost around $13,000, and we saved that in the first few months by doing our own autopsy. So it was the best deal we could have ever came and done. So, yes. Any other questions?
Anybody else? Oh,
and the other thing about the budget amendment, that's my estimates based on the current numbers. A lot of times I've had to come back and ask for more, and we may not spend all that. The autopsies, if they tail off here at the end of the year, you know, it may be less than that, but that's my current figures based off of what we've done so far this year. And I hope it tails off a little bit, actually.
No, it's great, and thank you for the explanation. Anybody else have any questions? Okay, all in favor, say aye. Aye. Any opposed? Great, that passes.
Thank you.
Thanks for coming, Mr. Northrup. Budget Amendment 17-00050, Fund Department 621, State's Attorney Drug Forfeitures to 041 State's Attorney with increased appropriations of $5,000 for educational and training expenses and revenue from the fund balance. Had a motion from Mr. Anderson, second by Mr. King. Any discussion? All those in favor say aye. Aye. Any opposed? Okay, that passes. Next up, Budget Amendment 17-00051, Fund Department 679, Child Advocacy Center to 179 Child Advocacy Center, with increased appropriations and revenue of $15,000, making it revenue neutral. The reason is to pay for crisis clinicians, revenue from increased VOCA grant funding for the county of fiscal year 2017. Motion by Ms. Cowart and second by Mr. McGuire. Any discussion? Okay, all in favor say aye. Aye. Any opposed? Okay, that passes. We're up to the county administrator.
Your monthly budget report is in the yellow packet that was handed out tonight. We'll start with projections for revenue. This is largely unchanged in terms of the total for the November report. However, there has been some fluctuations in some of the lines. The biggest drivers to this expected deficit in revenues are related to the property taxes. As you recall, we prepared our levy to capture potential new growth revenue associated with a ruling in the hospital property tax case, and we were aware that that didn't occur and we wouldn't be receiving those revenues. Additionally, we've discussed basically every month the declining revenues for fees and fines. There has been some slight improvement since last month. However, those are still projected to be around $300,000 each under budget. Rents and royalties is about $90,000 under budget due to the loss of rent associated with the ILEAS because of the mold remediation issues. And finally, for interfund reimbursements, that is the projection that the nursing home will be unable to reimburse the county for the debt service in fiscal year 2017. I did have a chance today to look at what the impact of the income tax cut has been to the county thus far in 2017. And for July through November, that cost has been $102,000. I still am anticipating that we will receive the December accelerated payment. The state has made good on its promise to accelerate payments, so I'm projecting that we will get one more income tax disbursement for fiscal year 2017. On the expenditure side, projections are to underspend in fiscal year 2017 by approximately $500,000. There is a little bit of fluctuation in this number from last month. And finally, in regards to the summary, revenue to expenditure deficit is projected at negative $386,000 with a projected fund balance of $4.09 million and a percentage of the expenditure budget 11.4%. One thing we haven't really talked about for several months is included in this fund balance is about $300,000 in the auditor has recorded about $300,000 of this fund balance as reserve fund balance, and that's associated with the money that the general fund has in reserve for potential negative ruling in the hospital property tax exemption case. So just keep in mind that of this $4 million, about $300,000 of that is reserved fund balance. And last month, I think the fund balance projection was $3.97 million. So again, a slight improvement from last month's projection.
Does anybody have any questions on that portion of her report, of Ms. Ogden's report? Okay.
In regards to the budget changes, starting with the circuit court, for the additional expenditures in the amount of $74,000 down through planning and zoning. Those were budget amendments that were approved in November.
Any questions for Ms. Ogden? Okay, thank you very much for coming, and thank you once again for all of our information. Next up is the Job Content Evaluation Committee recommendation regarding the Circuit Court Executive Secretary position. If Ms. Busey would work on that, please.
And the Job Content Evaluation Committee met and reviewed the position, and based on the review and the information that was provided, did deem that a change was appropriate for this position and has effectively downgraded this position from grade range G to grade range F. So the motion to the Committee of the Whole is to approve that reclassification of the position.
Okay, that was moved by Mr. Hartke, seconded by Mr. King. Any discussion or questions? Mr. McGuire?
Yes, and you did say this is a downgrade?
Yes,
I just wanted to make note of that because some people question that they always go up, not
right.
down.
Not always.
Correct. Any other discussion or questions? All in favor, please say aye. Aye. Any opposed? Okay, that passes. Next up, there's a resolution for issuance of tax anticipation warrants for the Champaign County Nursing Home. Moved by Ms. Petrie, seconded by Chair Weibel. Discussion. Seeing none, all in favor, say aye. Aye. Any opposed, nay? Okay. That'll be fine, okay. Next up, we have a resolution authorizing renewal of loans to the Champaign County Nursing Home. Need a motion? So moved by Ms. Petrie, second by Mr. Rosales. Any discussion? All those in favor, say aye. Aye. All those opposed, nay? No? Okay. There we go. Then, other business, I have. Turn it back on. Have a resolution. I just overused it tonight, guys. F1, resolution approving agreement between the Champaign County Board and AFSCME Council 31 for their nursing home general unit, January 1 of 2017 to December 31 of 2018. A motion by Ms. Petrie, seconded by Mr. King. Does anybody have any questions? All those in favor say aye. Aye. All those opposed, no. Okay. And next up, resolution approving agreement between the Champaign County Board and AFSCME Council 31 for their nursing homes nurse unit, January 1 of 2016 to December 31 of 2018. Moved by Ms. Petrie, seconded by, Chris, Mr. Storr. Okay, any questions? This is 2016 to 18, a 2-year term here. Okay. Any questions? Nope. All those in favor say aye. Aye. Any opposed? No. Okay. Next, we're going to go to, let's see, we did the finance. An update on the payables. I believe we already did that earlier on off of our yellow sheet. So I have no report, and what I have designated for consent at this time is A3, A4, D1, 2, 3, 4, 5, 6, 7, 8, and E3. And that's it, sir.
Thank you, Ms. Michaels. Next up is policy, personnel and appointments. Mr. Rosales.
Okay, item A, we have 5 appointments and reappointments. So I'll let Pius go ahead and name his candidates for those appointments. Zoning Board of Appeals, there's 1 vacancy, term December 1st, 2017 through November 30th, 2022.
My choice is Ryan Elwell from Champaign Township.
All those, okay, moved and second by Asri. All those in favor? Any questions? All those in favor? Aye. Okay, oppose? Okay, motion passes. Item 2, Champaign-Urbana Mass Transit District, 1 vacancy. It's a Republican, term January 1st, 2018 through December 31st, 2022. Pius?
My choice is Richard Barnes.
Okay, moved by Pius, second by Rector. All those, any questions? All those in favor? Aye. All those opposed? Motion passes. Item number 3, Mental Health Board, 2 vacancies, term January 1st, 2018 through December 31st, 2021. Pius?
My selections are Susan Fowler, Susan Fowler and Tom Moore.
Okay, moved by Pius, second by Chris? Storr.
Yeah.
My apologies. Any
Mr.
questions? Pius?
Yeah, I want to point out that all three of these candidates are really marvelous candidates. I do hope to engage Mr. Gingold perhaps in a future open position, or actually bring him on as a sort of a person on the side who can help out. They're really all three are good.
Okay. Great. All those in favor? Aye. All those opposed? Any questions? Motion passes. Item 4. Posodum Consolidated Drainage District, one unexpired term ending on August 31st, 2019. Applicant is?
I select Mr. Lucas Meharry.
Okay. Second by Patterson. All those in favor? Aye. All those opposed? Any questions? Motion passes. Great. This is painful. County Board Clerk, to be placed that report on file. Item C, GIS. This is out of the Job Content Evaluation Committee. This is a request for a reevaluation of GIS specialist position. Any questions? Good. No vote, right? Could I get a motion on that? Moved by Keene, second by Patsy. All those in favor? Aye. All those opposed? Any questions? Motion passes. County Administrator. I ask to move to be placed that report on file. Moved by Anderson, second by King. All those in favor? Aye. All those opposed? Any questions? Motion passes. Other business, appointment of county auditor.
Yes, my selection is our very own Ms. Diane Michaels.
Moved by Pius, second by Goss. All those in favor? Aye. All those opposed? Any questions? Motion passes. Congratulations. Resolution dissolving the County Nursing Home Board of Directors. Moved by Mr. Goss, second by Rector. All those in favor?
Discussion.
Oh, discussion? We don't. Harkey?
I would just ask for a roll call, please.
Okay, could I get a roll call on that? Second by Lorraine Cowan.
Discussion?
Discussion? Goss?
Again, my only sole request on this was to bring more accountability to the county board. It had nothing to do with the folks that are on that resolution or on that advisory board. They've certainly done an admirable job. But as you saw tonight, I thought we had a lot of good questions for those folks that if we just present a financial report, we just gloss over it. And it doesn't really ever get discussed, where at least here we can discuss it. Now, I don't know that it's always as productive as we want it to be, but at least we've had an opportunity to ask questions. And I think in a group like this, sometimes questions get asked that help us all go a little bit further. So that's always been my push for this. If you support it, you support it. If you don't, you don't. So, thank you.
Mr. Anderson?
Thank you. I've served on the Nursing Home Board of Directors now, I guess, for 3 years. Currently chair. I think the nursing home, much like Mr. Goss, has gotten to a point of importance to this board that you can't afford not to hear what they have to say and what's being discussed. I sat here tonight and listened to the same basic presentation I heard last night. There's no sense in me doing that when that briefing belongs in this room. And we didn't ask as good a questions as I heard asked tonight, because there's such a diverse group in here. the greater the minds, the greater the power of the questions that can be asked and the thoughtfulness. I benefited more tonight than I did last night from the same briefing. And I think we would all benefit from that at this time. And the nursing home is basically in a position where it's causing this county financial distress. And I think we all need to be involved in this, because how can I leave a meeting where questions weren't asked that were as thorough as I heard tonight, and then come back and be expected to brief you in a few minutes when we spent over 40 minutes tonight listening to that? That's why I would be in support of this.
Any further questions? Patsy?
I have a number of questions, but first let me start with a comment. I understand why the Nursing Home Board of Directors evolved. That was Al Nudo. He was very concerned with the management of the nursing home, and he brought on board a management company and the concept of a board of directors. I don't know if he directly wrote the policy document for the board of directors. No, she's shaking her head. Okay, you did. All right. Anyway, there is a very good policy document for that board of directors, as the bylaws. What has concerned me once I read that document and the bylaws is the board of directors is given a lot of authority to oversee us as a county board, and had a high level of disappointment that that exchange does not happen on a regular basis. So I put that out there on the record. That board could do much more and do a lot more and education to us, and ask. I've attended those meetings for 5 years. Things have always concerned Mr. Henderson, one of them right now, and that is do not ask the robust questions that ought to be asked. And second is they request information from the firm, and the management firm never brings it to the next meeting, nor do they ask why it hasn't been brought to the next meeting. So if
You need a new microphone.
what happened?
It
Okay.
died.
All right. If in fact the vote this evening does dissolve this board of directors, what I need to hear from Chair Weibel and our interim county administrator is, are there things presently in the county board's bylaws and policy statement for the county board then to step into the role of managing and overseeing the nursing home?
Well, if you do a word search on the county board rules, nursing home is not mentioned at all. So that's one of the issues there. There's no obvious place how to fit into our rules of operation. We obviously could change that, but that takes some time. It also could maybe playing with the overall structure of how we meet too, which is an issue. Deb, you want to add to that?
Yeah, simply that before there was the bylaws and the nursing home board of directors, the nursing home reported specifically to a committee of the county board, because what you did tonight was ask for a lot of information that went beyond financial information with regard to the operation of the nursing home. So it's not really probably appropriate to just stick it under finance, and that means you need to change your rules. And in order to change your rules, you need to provide at least 2 weeks advance notice of the rules change before it's considered by policy. So you can certainly do that for the January meeting if someone has an idea of what, and it should probably come from all of you, if this body doesn't exist, what is it that you are proposing to replace it with?
Store, you had the next question, and then King after you.
Thank you. Patsy asked some of the question that crossed my mind. We have a vacancy on the nursing home board with the resignation of Ms. Busey. Is there a
certain expertise that could help serve the nursing home board to, should it go forward, and to help the facility in management and the patients.
Well, I'll speak to that from my experience, but certainly Josh could as well. Having been on the board as long as he has over time, we look for people who have expertise, ideally in the medical field and/or in finance, for example. But that's not an absolute. I think there's sometimes difficulty finding people, and therefore you may make a compromise. They're experts at what they do, but it may not be the best fit, if you will, to the benefit of the nursing home board. But take myself, for example, I have no experience in running nursing homes, being involved in finance, nor medical field. Now, I have experience as a public administrator at an executive level. Are those compatible? I probably, if you gave me what I was looking for as a choice, I wouldn't pick myself, so to speak, because those options I think would be more compatible for it. But even here, we're required to have 2 board members on that existing structure of a board of directors. Who here has those qualifications that we would like to see? Or maybe we don't need that from those 2. Maybe those 2 just kind of represent the public or this board. One could argue many things about that in that regard. Yes.
The bylaws do point out the different areas of expertise that are to be sought for the members of the nursing home board, and they actually are all fulfilled. I mean, they include health or medical experience, human resource or personnel management experience, financial experience, experience with social services, and marketing. And right now, the 5 members who are not nursing home board members, each of them brings one of those areas of expertise, with the exception of marketing. It has been difficult to find someone with that marketing experience to be appointed to the board. But, and there's a diversity of those different areas represented on the nursing home board right now.
And I believe you're quite correct, but it's like to say, well, somebody, not disparaging him by no means, but to say I have a person from the medical field on a board that deals with cardiology, but yet that's not their specialty. You know what I mean? So yeah, the bylaws are meant to be somewhat vague, and they are. So the compatibility is there, but how specific is another discussion.
Any further questions? Gross.
The concern I have is that we have a board that has a lot of accountability for funds that we're spending out of our general fund that aren't budgeted and aren't being cared for correctly. So are they a board that has a responsibility but without authority? Or if they do have the authority, they haven't exercised it in a fiduciary correct way? The finance of the nursing home are extremely poor, and I think that's been demonstrated. Nothing against them personally, but again, I'm not sure that they have the ability to make those changes on that board. On the other hand, we do have a great accountability. In fact, we have 100% accountability for our budget and the use of these funds. And there's a lot of things we could be doing with the $3 million or so we're spending a year that could impact our community, our youth, our trial programs. And we're not doing any of that because we're letting this go a step away from us. Again, not criticizing the board, it's a step away, and it really is our responsibility here to do so. And I would think that we should take that responsibility and take it very diligently, as this is probably the most important issue that we're really facing as a group, and hopefully we can get past and do the good things that we have on our radar.
Thank you very much, March, and then we'll go to King and then Pius.
So I guess I had 2 questions. The first one being, and I don't know who to direct it to, is there general consensus of the board to dissolve themselves? Do they feel like they, as a majority, are ineffective? Or could I don't know if the board members could speak to that.
I would gladly answer. We took a vote last night. Unanimously, the board voted that we should exist because our oversight role is necessary, And I would add to that that the board also offered unanimously to forego any per diem, since it's been stated that the $4,000 spent a year on that nursing home board of directors might be a part of the problem with financial issues over at the nursing home. So the board definitely believes it needs to exist. It definitely does the oversight. As long as I have the microphone here, I highly disagree with some of the opinions about the questions asked by that board. The board is a resource for management company. It has also been very involved in quality of care measures and things like that. I realize finance is the most important thing, and that does happen here. I would also add that even though there is a board of directors, the nursing home management company regularly reports to this body as well. And I don't see that the nursing home board of directors is an impediment to that.
Pius, thank you, Harkey, for that contribution.
I want to point out that the nursing home board of directors is an advisory board. They have no fiscal responsibilities. They never have. This county board has always had the fiscal responsibilities for the county board, or sorry, for the nursing home. It is not the advisory board. They're brought in. One way is involve the community, which it would involve people that have some expertise that this board does not have, and get them involved in management of what is considered to be a community asset. Now the question is, can we change that board to maybe make it fit in better with the current management team and certainly the current county board structure? That's what I would recommend. We try to modify it so that it fits in better with our existing county board and our also a new management firm, which is different from the last 8 years or so. So therefore, my vote will be to not dissolve it, because I think it'd be better if we changed it to make it better fit our needs.
Summers?
And further, I'm hearing Ms. Busey say that if we're going to dissolve it, we need to have another structure physically in place. And just that, I'm hearing a recommendation from our administrator saying, don't just dissolve it. If you want to change it, you're going to have to make those changes and plan ahead on it. At least 2 weeks is what I'm hearing, or notice in January. So I will not be voting to simply eliminate the board. It doesn't sound like that's the prudent thing for us to do as a body.
King?
So I'm not as familiar too, so pardon the question, but can the public engage the advisory board? So that there could be a back and forth between the public at that meeting, but not, no? Okay.
Sorry. They speak to the board, but there's no dialogue, but there can be after, certainly. Last night we had one speaker, well, two. One was Ms. Petrie, but the other speaker was Mr. Laker. You heard him tonight. So, yeah. Certainly it could be dissolved tonight, and then I think we expect the same management board to be here in January and give the exact same report they're going to give to the existing, well, the board that exists now unless it gets dissolved. So we'll skip a month, but they'll still be here talking to this board. So as opposed to structuring something before we dissolve, but either way works.
Are there any further questions? Any comments? Okay, we're ready to vote. Could I get a roll call on that, please? Thank you.
King,
No.
Yes.
Marsh, McGuire, Michaels, Patterson,
No.
Petrie,
No.
Rector, Storr, Summers, Tinsley,
No.
Weibel, Anderson, Clemens, Coert, Cruz, Esri,
Yes.
Furtado,
No.
Goss,
Yes.
Harper,
Yes.
Hartke,
No.
and Rosales.
No.
It's 9-12.
Okay, motion fails. Good. And we can move on. Did we pull 3 and 4? Oh. Number 3, appointment of Max Mitchell to the Economic Development Corporation.
Well, actually, I have to make that. So I move to appoint Max Mitchell to the EDC.
That's what I was saying. Okay, second by Harkey.
Discussion.
Discussion?
I have some. Yeah, I generally don't like appointing people when they're not here, but I did talk. It's happened to me before, not here, but other places. But I did talk to Max a week ago, I think, and he certainly agreed to do that. He's already on the EDC as a private citizen, but he can obviously hand that over to somebody else. He has been actively involved in that, and if you don't, the reason he's not here, of course, he just got a new knee, and hopefully he's out practicing that knee, and I'm not sure if he'll be at the next meeting, but hopefully he'll get out here soon.
Patsy.
I have a point of clarification on this. Not that I mind Max as a suggestion, but I thought previously it had been moved and seconded and voted on that the county administrator would be the person going to the EDC meetings.
That is correct. However, the current county administrator is interim county administrator, and part of their contract said that she'd only be partially fulfilling some of those duties. That's not one of them.
Okay, thanks for the clarification.
It's not in the ordinance either.
I did have one question, Pius, of clarity. Isn't Max Mitchell resigning after this term? So I would imagine this appointment is only up
It's
to
just
the end of his
well,
resignation?
all these appointments are till the end of the term. So.
Okay, great. All those in favor? Aye. All those opposed? Any questions? Motion passes. Number 4, appointment of Steve Summer. What was that? Passed that. Okay, we go to 6. Great. Resolution endorsing the Illinois Bicentennial Celebration, which is at the end of your packet, page 88. Okay, moved by Patsy, second by Anderson. All those in discussion?
I do want to point out that we were supposed to pass this resolution last month, so it'd be before the official opening ceremonies, which occurred at the beginning of the month, but we didn't get it until later in the month, so we didn't have time to get it on the agenda.
Any further discussion? Thank you, Pius. Okay, all those in favor? All those opposed? Motion passes. Great. Items to be placed on the consent agenda, that's 8, 1 through 5, E1 and 3, I believe. And 6. E1, 3, and 6. Okay.
Thank you very much, Mr. Rosales.
Thank
Finally,
you.
we have under other business, I seek a motion to create the committee that will work on the county executive style of government transition. Moved by Mr. Anderson, second by Ms. Michaels. I plan to fill this at the county board meeting, so you'll have a week to decide if you want to be on it or not. Please let me know. All in favor? Aye. All opposed? Motion carries. Seeing that, I see no other business, so we are adjourned.